Well, it's estimated that 80% of adults will suffer from lower back pain at some point in their life, and it seems like there are just as many misconceptions about back pain as there are back pain sufferers. So to help share the truth about back pain and how you can feel better is Dr. Scott McCarty, a spine surgeon from our sponsor, the Detroit Medical Center. Good morning, doctor. Thanks for being with us.
Good morning. Thanks for having me.
Absolutely. So you have some questions, true and false questions, to help set the record straight about all of this for people who may have heard what they think they know about back pain, and we're going to sort it all out. Now, you're going to ask me these questions, right?
Yes.
And then I'm going to guess if it's true or false.
Absolutely.
All right, so let's get into it. What's the first question?
All right, first question here. True or false, bed rest is the best cure for back pain?
Bed rest is the cure. I'm going to say false.
You are correct.
Am I?
This
Okay.
one is false. Now, this is a common misconception among the general population, but it is better to get up, be active. Prolonged bed rest can lead to delaying the recovery process because it can cause stiffness, deconditioning, which results in more pain.
Okay.
So it is better to be active, right? Return to activities such as walking as soon as they feel comfortable. And that is going to lead to faster recovery for the patient.
Okay. I know that answer from experience.
Okay.
So I've had a little back pain, I feel better after I move around a little. So let's get to the next one.
All right. Next question. True or false? Bad posture causes back pain.
Bad posture. I think it can. I feel like it can. True?
So that one is true.
Oh, okay, good.
So, bad posture is not going to cause acute or sudden onset pain, but maintaining poor posture over time can put unnatural stress on the muscles, joints, and other supporting structures of the spine that can cause pain over time.
Okay.
So it's important when walking that you want to maintain a neutral upright alignment, right? Head centered over the shoulders, centered over the hips. You want to keep your shoulders in a relaxed position.
Okay. As soon as the doctor said that, I started sitting up like this.
And then if you're in a seated position, make sure you have back support. Keep those shoulders in the same relaxed position, but you want to have them rolled back slightly.
Okay.
And then if you're going to be seated for a prolonged period of time, if you do that at work, make sure that you have good lumbar support so you're supporting the lower back a little bit more.
Okay, great advice. All right, so what's the next one?
Next question. You're doing great.
Thank you.
True or false, smoking and vaping can increase your chance of back pain?
Smoking or vaping? I'm going to say true.
True. So that one is true as well. So the Center for Disease Control has actually found a strong link between smoking and back pain.
Wow.
And we know that smoking can lead to accelerated degeneration of the discs that are in the spine, which can cause pain. It's also been known to decrease bone mineral density, so that weakens the bone and can lead to fragility fractures, so patients can experience fractures in their spine. And when that happens, as you can imagine, it can be quite painful, and it can take several months for it to resolve.
And people will definitely be seeing you if that happens, I'm pretty sure, yeah. So what's the next one?
Our last question here, Tati. True or false, herniated discs need to be surgically treated?
I don't know. I really don't know. I'm going to say right in the middle, because I don't know.
This one is false.
False?
Thankfully,
Okay.
yeah. Majority of herniated discs can be treated conservatively.
Okay.
So nearly 90% of patients are going to have complete or near complete resolution of their pain within 3 months of symptom onset.
Okay.
So here at the DMC, we're able to help manage symptoms until they do have resolution of their pain with conservative options like physical therapy, medication, or even steroid injections.
Okay. But then how do we know when it comes to back pain? Because it is so common and it kind of comes and goes. When should someone at home know that it's time to be treated by someone like you?
So, as you alluded to earlier, back pain is very common. Usually it's mild and resolves on its own in a couple of weeks. So patients can treat their pain at home when they are able to mobilize, and they can use Tylenol, over-the-counter anti-inflammatory medications. They should see a specialist if their back pain is also associated with leg symptoms like numbness, tingling, weakness, or if they're finding worsening or new symptoms.
Okay. Dr. McCarty with the DMC, thank you so much for sharing this great information with us.
Thanks for playing the game.
That was my pleasure. I almost got them all right. All right. For more information or to make an appointment with a spine physician, visit dmc.org/spine. Again, that's dmc.org/spine.